I'm Jeanette, the nurse educator at Parkside OB-GYN. I'd like to talk about blood types for a few minutes, and if your blood type is negative, this will be good information for you to have. You can find out your blood type when your prenatal labs result in the Helo app. So you might have noticed blood typing as part of your prenatal lab work. The blood type is the letter. It's either A, B, AB, or O. And then you're going to see negative or positive beside it. This is your Rh factor. Rh factor is a protein on the red blood cell of some people, but not all people. So if your blood type is positive, you have the Rh factor protein in your blood. You can receive blood from either Rh negative or Rh positive people. However, if your blood type is negative, it cannot come in contact with Rh positive blood cells. If it does, your body will recognize that as a foreign protein and will begin to create an immune response against it. Your blood is also tested for the presence of any antibodies that could affect your pregnancy. So RHIG, commonly referred to by its brand name of RhoGAM, is a medicine that's given to you in order to prevent your body from forming a defense against Rh positive blood cells. And it will need to be given each pregnancy. It's normally given in the OB office at 28 weeks, but you may receive an earlier dose if you have any abnormal bleeding during your pregnancy. And then when your baby is born, their blood type will be determined using blood from the umbilical cord. If your baby is Rh negative, you don't need to receive any RhoGAM postpartum. But what if your baby is Rh positive? Well, your nurse will order a lab called a fetal screen that basically is checking for any indication of a reaction happening if your baby's blood and your blood had intermingled. And if that test is negative, the nurse will give you a dose of RhoGAM postpartum. If the fetal screen reveals any signs of an interaction, more tests are ran on the blood in the lab to determine how much RhoGAM you need postpartum to make sure your body does not attack any future pregnancies. Usually it's just one dose, but some people do need more. I do like patients to know that in the hospital, RhoGAM can be given in your IV. That can save you a shot in the bottom. So try to keep it in, even if it's not hooked to anything, until you know your baby's blood type and how much RhoGAM you'll need. Please keep in mind this is general information and is intended to help Parkside OB-GYN patients make informed decisions. It is not meant to replace any advice or guidance from a provider.